Welcome once more to this YouTube channel. Kindly subscribe to this channel. The topic is medical imaging of the pelvis. Medical imaging of the pelvis. How does the pelvis look under radiological examination? You need to understand the anatomy of the pelvis under radiological examination. Various diagnostic imaging techniques are used to diagnose pelvic disease and fractures. These imaging modalities are also used to assess congenital anomalies of the pelvis and pelvic organs. For example, pelvic radiograph. When you examine the pelvic radiograph, you'll be able to appreciate pelvic fracture just like you have here. Right here is an illustration of a pelvic radiograph. You can see a fracture of iliac bone and also dislocation of the pubic symphysis. So radiography is one of the medical imaging modalities that you could use to study the anatomy of the pelvis. Plain radiographs of the pelvis are often used as screening tools in patients with symptoms of pelvic disease. Contrast agents could be given to these patients, and this enhance the visualization of pelvic organs and the blood vessels that you find in the pelvis. Hysterosalpingography is very important as far as radiographic examination of the pelvis is concerned. In this procedure, hysterosalpingography actually involves the radiographic dye injected into the uterine cavity and tubes, and it enables you to study and demonstrate the anatomy of the uterine tube and also to appreciate the tube patency. Hysterosalpingography is very important in detecting uterine and uterine abnormalities as well as abnormalities of the uterine tubes. Example is bicornuate uterus. Right here is an illustration of Hysterosalpingogram. You can see the uterus demarcated there with the white color. The uterine tubes are also illustrated there. As far as radiography is concerned, radiography of the pelvic region, arteriography must be mentioned. Arteriography involves visualization of the pelvic arteries by X-ray imaging after injection of a radiopaque contrast medium, and arteriography is used to demonstrate the pelvic arteries. Next, I really need to talk about ultrasonography, also called sonography, an imaging modality used for obstetrical examination and for early evaluation of pelvic disorders such as some cases of cancer and also congenital anomalies. Trans-abdominal ultrasound scanning requires a fully distended urinary bladder. This is done to displace, you need this to displace the bowel loops from the pelvis and to give an acoustic window through which to observe pelvic anatomy. Now you have the introduction of transrectal and transvaginal ultrasonography, and these procedures afford enhanced resolution of pelvic structures. Transvaginal and transrectal ultrasonography enables the placing of the probe closer to the structures of interest, and this affords increased resolution. For example, with a transrectal and transvaginal ultrasonography, you can appreciate intrauterine blastocyst implantations 7 to 10 days earlier than you will see with a transabdominal ultrasound scanning. Right here is an illustration of the female pelvic ultrasound scan, and you can see the various parts of the uterus there, the myometrium and the endometrium especially. Next is computed tomography. This is another imaging modality that enables you to appreciate the anatomy of the pelvis. The anatomy of the pelvis is well demonstrated by CT, that's the computed tomography. You must know that the presence of extraperitoneal fat and the relative absence of motion artifacts makes it possible to have excellent resolution with CT. An axial scan, that's a CT scan that is done transverse to the axis of the body, is usually satisfactory. You can also have the sagittal and the coronal, sagittal and coronal sections, planes, and this give additional information. The CTs are a very important modality for assessing local tumor extent, and it helps you also to detect metastasis, and it is accurate in detecting post-operative some post-operative conditions like post-operative abscesses and other forms of abscesses. Magnetic resonance imaging is one imaging modality that I cannot afford to ignore. Magnetic resonance imaging provides excellent evaluation of pelvic structures and permits outstanding delineation of the uterus and ovaries. Magnetic resonance imaging also permits the identification of tumors, for example, myoma and other benign neoplasm. Also, magnetic resonance imaging allows examination of radiological examination of congenital anomalies like bicornuate uterus. Right here is an illustration of a magnetic resonance image of a female pelvis. When you take a close look, you can see the uterus, the cervix clearly. You can even appreciate the ligaments like the cardinal ligament and the sacrouterine ligament. So magnetic resonance imaging modality gives you a clear image not just of the viscera, but you can also see some other structures like the ligament as well. Don't forget to subscribe to this channel. Thank you so much for listening. Goodbye for now.